Hi, this is Dr. Reynaldo ROJoson, Director of the ROJoson PEP Talk. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the PEP Talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer. My pep talk today is entitled Fever and Paracetamol, Myth and Tips. This is part of the health issue course. The empowerment objective is for the lay people to have an understanding of the issues involved in fever and paracetamol. In this time of COVID pandemic in the Philippines, since March 2020 up to the present, January 22, almost 2 years, among other things, we commonly hear and see in the news from newscasters, physicians' advice, patient sharing, the varying perceptions and recommendations on fever and paracetamol. Examples: when you have fever, suspect COVID-19. When you have a temperature of 37.5, you have fever. When you have fever, take paracetamol. The branded paracetamol is out of stock in the drugstores, etc. Fever and paracetamol are always in the news, especially in this Omicron surge. With the varying perceptions and recommendations on fever and paracetamol being disseminated by newscasters, physicians, and lay people, the public is naturally and expectedly confused and anxious. Case in point, a reaction to a medical tip that I posted on January 16, 2022. I said medications as needed, only as needed for moderate to severe symptoms, and paracetamol for fever 39 degrees and above. So this was a reaction from one of a reader in my Facebook. By the way, may typographical error ba kayo regarding time to take paracetamol? Nakatype doon 39 degrees centigrade. Tama ba? If adults 37.9 need to take na paracetamol. I answered, no typo. Yes, it's correct. As written, 39 degrees centigrade. Then I reinforced my response with a published quote from an infectious disease specialist. Give paracetamol only if temperature is more than 38.5 degrees or if the symptoms are really troublesome. I usually allow low-grade fever, 37.5 to 38.5, to occur because this is also part of the body's response to kill the virus. If with low-grade fever, take a bath, wear loose clothing, take lots of fluids, and rest. This incident prompted me to do a pep talk on these issues right away, while it's still hot, to correct the myth and give tips. So, what are the issues involved associated with fever and paracetamol? For fever, the common issues are what are the common perceptions and practices with regards to fever that are considered myth and need adjustment, if not correction, both by the public and healthcare professionals. So, common issues involved on fever. What is fever? When does one say one definitely has a fever? What is the temperature that will definitely signify one has a fever? And what is the meaning and significance of fever? For paracetamol, what are the common perceptions and practices with regards to paracetamol that are considered myth and need adjustment, if not correction, both by the public and healthcare professionals? Common issues of paracetamol. What are the uses of paracetamol? Does one has to take paracetamol all the time when one has fever? So let's start with the fever. What is a fever? Fever is an increase in the body temperature felt by a person as unusual warm or hot sensation, or thus N, registered in the thermometer as elevated above a value that is rightfully accepted as normal. If the normal value is 37 degrees centigrade, then anything above 37 is fever. If the normal value is 37.5, then anything above 37.5 is fever. If the normal value is 37.9, then anything above 37.9 is fever. So the main issue here, what is rightfully the normal value? If there's an N, meaning felt by a person as usually warm or hot sensation and registered in a thermometer as elevated above a value that is rightfully accepted as normal, most likely the person really has fever. But if it's an or, the degree of certainty of the fever is not as high as in the N case. Ideally, a thermometer determination is advisable to validate the warm and hot sensation. If normal, the warm or hot sensation may be non-specific or transitory. If the or is the case, the degree of certainty of the fever is not as high as in the N case. A thermometer reading above the normal value without warm or hot sensation needs to be rechecked before declaring the presence of fever. So when do you say you definitely have fever? Fever is said to be definitely present if an increase in the body temperature is felt by the person as unusual warm or hot sensation, and, not or this time, and, registered in a thermometer as elevated above a value that is rightfully accepted as normal. Again, the issue is, what is that normal value? What temperature, or what is the temperature registered on the thermometer that will definitely signify one has fever? The myth of 37 degree as the normal value, normal temperature, is prevalent up to now. In the history of this myth, in the mid-1800s, a German doctor, Karl Wunderlich, measured the armpit temperatures of about 25,000 people and came out with an average of 37 degrees centigrade. Since then up to now, 37 degrees centigrade is considered as the normal value, normal temperature. So more than 37 degrees is considered fever. Newer research suggests that the number has since gone down. Records from 3 periods between 1860 to 2017, where there were 677,423 measurements among Americans were made, show that the average temperature is now 36.6 degrees centigrade. Possible reasons for the lowering of the body temperature: lower metabolic rates, lower infection rates in the community nowadays, and better thermometers. In the Philippines, we don't have similar research that has determined the average body temperature of normal Filipinos. One that we can use to help us determine what value is considered normal and what is considered to be fever among Filipinos. In my 1 year of experience, 2021 to 2022, in monitoring the temperatures of the Filipinos during the COVID crisis, I discovered and noticed the trend for normal body temperature is to be lower than 37 degrees centigrade, mostly 36 degrees centigrade plus or minus. Examples are seen below. A monitoring temperature sheet data given to me by a patient. So temperature in the morning on September 23, 36.6, afternoon 36.5, evening 35.8. On the next day, morning 36.8, afternoon 36.6, evening 36.9. And on September 27, morning 36.4, afternoon 35.9, and evening 36.8. Okay. So all the temperatures were below 37 degrees centigrade. The body temperatures differ from persons to persons and in different times of the day with varied kinds of activities and environment. Thus, it is better to talk of a range of values rather than a single value that is considered as normal, above and below which are abnormal, either hyperthermia or fever, or hypothermia. Okay. So, at present, majority of experts, particularly coming from the Center for Disease Control, consider 38 degrees centigrade and above as hyperthermia and 35 degrees centigrade and below as hypothermia. Up to now, there's a lot of confusion going on among lay people as well as healthcare professionals and organizations as to what constitutes fever. This confusion has a lot of potential negative repercussions. In the COVID-19 pandemic and crisis, we have to know what measured temperature is considered fever, as fever is the primary symptom used to suspect COVID-19 and to monitor the course of a COVID-19 infection. So there are different perceptions between and among lay people, nurses, and physicians based on the survey that I made in April 2021. This is the result of the survey. So lay people have varying perception of the temperature from 36 to 38.9. For the nurses, again, varying perceptions among the profession and comparing to the lay people. Okay. So 3 to 38, 36 to 38.9. Again, for the physicians, 36 to even 39 or higher is the perceived temperature of fever. So you can see the different perceptions between and among lay people, nurses, and physicians. The potential repercussions of these differential perceptions, one of which is not having a common interpretation of the temperature gotten from a digital thermometer, will lead to a miscommunication among people, particularly among lay people and physicians and between nurses and physicians. The miscommunication may lead to wrong decision-making and actions. Another repercussion, potential repercussion, if a patient wrongly thinks a fever is present because of a certain temperature reading, he or she may panic and think she may have COVID as fever is being considered as the primary symptom in suspecting COVID in this time of COVID-19 pandemic. She may go for a COVID test, which may turn out to be uncalled for because of a false interpretation of temperature. All over the world, the Philippines included, there is no uniformity or consensus on what one specific measured temperature is to be considered fever. Examples, the Centers for Disease Control and Prevention in the USA uses 38 degrees centigrade as fever. The World Health Organization uses 37.5 in the axilla and temperature, and 38 degrees centigrade for rectal temperature as a cutoff for fever. The Department of Health of the Philippines, based on an infographic, uses 37.5 as the cutoff as fever. And the Philippine Society of Microbiology and Infectious Diseases has not declared any cutoff for fever. So how do we resolve the issue? As I said, the body temperatures differ from persons to persons and in different times of the day with varied kinds of activities and environment. Thus, it is best to take and monitor your own baseline usual body temperature so that you can use it as a basis for determining your own fever when it occurs. So I'll try to the way to do this is to for 3 consecutive days, 3 times a day, morning, okay, before meals, morning, noon, or afternoon and evening. Okay, using a digital thermometer, measure your temperatures, armpit and or the mouth to get your usual baseline. Okay, then get the average. So after computing and determining your average body temperature for both the armpit and the mouth areas, keep these records and use them to determine the presence or absence of fever in the future. Use at least 1 centigrade elevation as a basis for saying you have a fever. 1 degree centigrade elevation over your usual normal body temperature. So this is an example of a monitoring. Okay. Day 1, day 2, day 3, the average. Okay, in the morning, 36.6, 36.5, 35.8. So the average is 36.3. In the 12 to 1, okay, the afternoon, 36.8, 35.6, 36.9. So the average 36.4. In the evening or in the late afternoon, 36.4, 37, 35.9, 36.8, 36.3. So getting the average for the whole day, 1, 2, 3, and then getting the average for the 3 days, you come out with 36.4. So this is the usual baseline temperature of this particular person. So in the meantime that you don't have a baseline determination of your normal or usual body temperature, you can use 38 degree as a basis for determining fever. But it goes without saying that you should also have an accompanying warm feeling or warm touch of your body to complement the measured temperature for a diagnosis of fever. 38 degrees centigrade is equivalent to a low-grade fever, 39 moderate-grade fever, and 40 high-grade fever. Sinat or lagnat. Filipinos commonly use the word sinat. What does it really mean? I don't exactly know the answer. It may mean low-grade fever, but here is my take on the issue. If lagnat is fever and fever is 38 degrees centigrade, or at least 1 centigrade higher than your usual baseline temperature, then what is sinat? Sinat is an unusually and persistent warm or hot feeling. If this synod is accompanied by an abnormally elevated temperature, at least 38 degrees, then it is in reality a lagnat or fever. If it is not accompanied by an abnormally elevated temperature, then it remains as synod, or warm or hot feeling, and not fever. It cannot be a mild fever, as 38 degrees centigrade is operationally defined as low-grade or mild fever. Fever or lagnat is said to be definitely present if an increase in the body temperature is felt by the person as unusual warm or hot sensation and registered in a thermometer as elevated above a value that is rightfully accepted as normal, or at least 38 degrees, or at least 38 degrees centigrade, or at least 1 degree centigrade higher than one's usual body temperature. So as I said, the fever differs, the body temperature differs from one person to another, or from persons to persons in different times of the day with varied kinds of activities and environment. They also differ where the temperature is gotten: mouth, armpit, rectum, forehead, and hand. Okay, so usually the rectal temperature has the highest recorded temperature, or in the rectum, it has the highest recorded temperature, and then mouth, then oral temperature cavity, okay, and then the armpit. Again, the body temperatures also differ with the type of thermometers used. For practical reason, just take the armpit or mouth temperature and use at least the least expensive digital thermometer, but make sure to check the accuracy of the thermometer that you're using. Fever can be caused by a lot of things. There could be non-specific causes, meaning fever whose exact causes cannot be definitely identified. Specific causes, meaning the fever whose exact cause can be definitely identified. Example, fever caused by excessive exercise, environment fever, fever caused by infection, etc. Fever is not a disease, and it's not a disease. Fever is a reaction of the body against something disturbing it. Fever is a symptom felt by a person that may signify that a medical condition or a disease is going on. And fever is a protective mechanism and is a sign that the body immune system is on, is functional. So with fever being a protective mechanism and a sign that the body immune system is on, fever can spontaneously disappear even without treatment. Fever can and should disappear after active treatment, especially after removal or resolution of the cause. So management of fever, basic principles: treat the cause of the fever if identified before considering treating the fever itself. Remember, fever is a symptom or a reaction, not the disease. Number two, basic principle is to treat the fever only when indicated and properly. So this means that you don't have to treat all kinds of fever. Okay, or the moment you have fever, you don't have to treat it right away. Some ways to treat the fever so that you can treat it when indicated and properly. Rest, it's a must that you must rest. Plenty of fluids, also a must. Loose clothing and cool environment, must. Lukewarm baths, must. Drugs may use only as indicated, and corollary to that, it may not be needed after all. So drugs commonly used for fever is the paracetamol or the paracetamol. The action of the paracetamol is on the area in the brain that regulates the body temperature, the hypothalamic heat regulating center. Okay. For adults, the dosage is 500 milligrams to 1,000 milligrams every 4 to 6 hours, maximum of 4,000 milligrams per day. So the recommendation is to leave at least 4 hours between, at least 4 hours, can be 6 hours, can be 8 hours between recommended doses. And it's also not recommended to take paracetamol for more than 5 days because of the danger of liver failure. As much as possible, avoid taking paracetamol. So that's the advice. Use it only for high-grade fever or severely uncomfortable hot feeling, not relieved by cooling environment. Fever is a protective mechanism and a sign that the body immune system is on. So allow the fever to do its job of fighting against the cause or the infection. Just like we try to kill germs by boiling or burning, the body increases the body temperature in an attempt to kill the infecting germs. By actively controlling the fever, let's say with paracetamol, we're actually suppressing the body's own mechanism of fighting the infecting germs. Recent researches have shown that the higher the temperature in severe bacterial infections, the better is the survival rate. So fever is a protective mechanism. Blocking fever can be harmful because fever, along with other sickness symptoms, evolved as a defense against the infection. Fever works by causing more damage to the pathogens, to the bacteria, to the virus, and infected cells than it does to healthy cells in the body. So this was cited in this particular journal. Let's fever do its job, the meaning of fever in the pandemic area. So for infections with COVID-19, we advise that fever should be allowed to run its course. Other reasons for not giving paracetamol left and right: fever may disappear even without taking paracetamol after body immune mechanism controls the inciting cause, meaning you can just do watch and wait approach. The other reason is to use the temperature as a monitoring guide to see if a person is getting well already without paracetamol. If one takes paracetamol, the temperature will go down definitely and artificially. The fever will be hidden. There will be no good gauge of recovering. In the supporting this stance, in the COVID-19 guidelines, there is a mention of this one criterion of recovery and ending of isolation. Let's say 10 to 14 days or 21 days. Person has no fever for 24 hours at least. Some would choose 3 days, no fever. And the caveat and the requirement is that there should be no fever reducing medications like paracetamol. So summary and takeaway. I have discussed the issues involved in fever and paracetamol, the myth and tips I've given. Specifically, I have defined fever. I've explained the difference between CNAT and lagnat and the meaning and significance of fever, and also when to use and when not to use paracetamol. Takeaway in relation to patient empowerment: be always in touch with reliable medical information on issues on fever and paracetamol. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in managing fever and using paracetamol. So with that, I end my pep talk. Health issue, fever, and paracetamol, myth and tips. I hope I have empowered you to have a better understanding of the issues involved in fever, in managing fever, and in the use of paracetamol. Thank you for your kind attention. Mabuhay kayong lahat.